Okay, so this is about the umbilical fascia. So, umbilical fascia is something that goes around the umbilicus, and it is a layer of the anterior abdominal wall. So, in the region of the umbilicus, anterior abdominal wall consists of several layers. So, it is actually a thickened portion of the transversalis fascia behind the umbilicus. So transverse fascia is a thin layer of fascia that lines the transverse abdominis muscle. In the lower abdomen, particularly below the arcuate line, located halfway between the umbilicus and pubic symphysis, the posterior wall of the rectal sheath is formed only by the transverse fascia and the parietal peritoneum. So the linea alba is umbilicus is located within the linea alba, which is a fibrous band formed by fusion of aponeurosis of abdominal muscles. So, umbilicus itself is described as a defect in the linea alba through which the fetal umbilical vessels once passed. So, it is a defect because that is the place where umbilical vessels once passed. So, at the umbilicus, skin is not loosely attached as it is to somewhere else in the abdomen. Instead, it is firmly uh, attached to the underlying scar tissue. So, normally the skin is loosely attached to the underlying structures except at the umbilicus. So, the natural lines of the cleavage in the skin are constant and run downward and forward, almost horizontally around the trunk. So, umbilicus is a scar representing the site of the attachment of the umbilical foot, which is situated in the linea alba. So, on the posterior aspect of the umbilicus, peritoneum is placed into several umbilical folds. That is on the posterior aspect of the umbilicus. So, there are medial umbilical fold that contains the ureters, obliterated fetal allantois, which runs from the apex of the bladder to the umbilicus. Medial umbilical folds are there contain the obliterated umbilical arteries. Lateral umbilical folds are there formed by the peritoneum covering the inferior epigastric vessels. Notably, unlike the others, they do not reach the umbilicus. And then we have the falciform ligament that spreads upward from the posterior aspect of the umbilicus to the liver, containing the ligamentum teres, the obliterated fetal left umbilical vein in the free border. So, clinical significance of disease, there can be congenital umbilical hernia. So this occurs when part of the midgut fails to return to the abdominal cavity from the extramburnic coelom during development. An acquired infantile umbilical hernia happens, a small hernia caused by the weakness in the scarf the umbilicus within the linea. And also para-umbilical hernia can happen. That commonly happens in adults, especially women. This hernia does not pass through the umbilical scar itself, but through the linea alba in the immediate region of the umbilical. So these hernias can contain holes of intestine and omentum. So that is about the hernia. So umbilical hernia, congenital umbilical hernia is caused by failure of part of the midgut to return to the abdominal cavity from the extrambronic coelom during fetal life. And acquired in umbilical hernia, infantile, is a small hernia that sometimes occurs in children and is acquired by weakness in the scarf the umbilicus in the lines of linea alba. So most become small and disappear without treatment as the abdominal cavity enlarges. So they usually they disappears. So acquired umbilical hernia of adults is most correctly referred to as para-umbilical hernia. The hernial sac does not protrude through the umbilical scar, but through the linea alba in the region of the umbilicus. Parambrical hernia gradually increases in size and hang downward. The neck of the sac may be narrow, but the body of the sac often contains parts of small and large intestine and omentum. So parambilical hernia are much more common in women than men. So that is about the hernias and congenital hernias, and this one is there. And also cicatrice can also be felt and seen at the posterior aspect of the umbilicus. And from this, the falciform ligament sweeps upwards and slightly to the right of the midline to the liver. In the free body of the ligament lies the ligamentum teres, the obliterated flatal left umbilical vein, which passes into the groove between the caudate lobe and the left lobe of the liver. So elsewhere, the peritoneum seats over the inferior aspect of the diaphragm to be reflected onto the liver, leaving a bare area demarcated by the upper and lower coronary ligaments of the liver and onto the right margin of the abdominal esophagus. After enclosing the liver, the peritoneum descends from porta hyper. It is like a double sheet, the lesser omentum to the lesser curve of the stomach. Here it again split into enclose the organ, reforms at the greater curve, then loops back downwards and then up again to attach the length of the transverse column, forming the apron-like greater omentum. So that is how the cradle-like curtain-like thing has formed. Uh, so the area of the liver is demarcated by which ones? Comment the answer in chat. Comment down your answer.